Hello, this is Dr. Peter D'Amore from the Orthopedic Center of South Florida. I'm here today to talk about another common condition seen in spine surgery known as cervical radiculopathy. Radiculopathy, often referred to as a pinched nerve, comes from the Latin word meaning root and the Greek word meaning suffering. Radiculopathy generally refers to pain, discomfort, or electrical sensations that radiate down the arm or the leg because of a nerve root being compressed or irritated. Cervical radiculopathy refers to a pinched nerve in the neck that leads to pain and discomfort going down the arm, sometimes all the way to the fingertips. Similarly, lumbar radiculopathy refers to a pinched nerve in the lower back that leads to pain and discomfort going down the front or the back of the leg all the way to the toes on occasion. Patients experiencing cervical radiculopathy may experience pain described often as burning, stabbing, or electrical. They may notice symptoms including tingling or numbness, often described as pins and needles or static in their fingers and hands. Patients may experience weakness in their shoulders, arms, or hands. Sometimes patients report decreased sensation or pain associated with moving their neck in a particular way. There are several causes of cervical radiculopathy. As we live out our lives and get older, our spines, like other joints in the body, show evidence of wear and tear. The discs between the bones of the spine, called the vertebral bodies, can wear out and collapse over time, contributing to arthritis or bone spurs to form. We refer to this generalized degeneration of the discs and bones in the cervical spine as spondylosis. Spondylosis, in addition to arthritis, bone spurs, and herniated discs, can lead to inflammation and narrowing on the area of the spine where the nerve roots branch off the spinal cord to innervate the muscles and skin on the arms. This area, called the neuroforamen, refers to a small hole or passage. In order to diagnose radiculopathy, we perform a careful physical examination and listen to your specific complaints. Often, patients will tell us about a shooting pain down one or both arms that may be worsened with certain head positions or activities. Patients sometimes report weakness in both arms that can be related to a pinched nerve. In addition to performing a physical examination and listening to your specific issues and complaints, we will order specific X-ray views to look for arthritis and potential instability of the spine that could cause the nerve root irritation. An MRI is typically ordered to gain greater visualization of the spinal cord and nerve roots. The MRI helps us determine where the nerves are being compressed and what specific nerves are being compressed by arthritis, disc herniations, or a combination of both. In specific circumstances, a CT scan may be ordered to gain better visualization of the bones of the neck and to help with diagnosis and preoperative planning. Additionally, sometimes patients have compression of their nerves in more than one spot. We call this a double crush phenomenon. This means that the nerve may be pinched not only in the neck, but also somewhere in the arm. We commonly see this with carpal tunnel and cubital tunnel syndrome, referring to a compression of a nerve in the wrist or a nerve at the elbow. We may order a special test to help determine where the nerve is being compressed. Fortunately, a majority of cases of cervical radiculopathy are self-limiting. In fact, many patients can achieve symptomatic improvement with non-operative care only. Conservative or non-operative treatments that may help with radiculopathy include brief periods of rest and activity modification. Sometimes, anti-inflammatories and oral steroids may help to decrease the inflammation and associated pain of an irritated or pinched nerve. Physical therapy is often prescribed to help strengthen the stabilizing muscles of the neck and to perform procedures that may help with muscle tension and also pain. Sometimes, steroid injections can be used in the spine for diagnostic and therapeutic purposes. These injections can help decrease inflammation around pinched nerves and help treat the pain associated with nerve root inflammation. Sometimes, despite a combination of medications, physical therapy, and injections, patients still experience pain and discomfort that can become a nuisance to their occupations and their daily lives. If this is the case, or if a patient develops neurologic deficits, including progressive weakness or numbness, we often discuss surgical intervention. If surgery is indicated for decompression of a pinched nerve, the surgeries performed to treat radiculopathy have a high surgical success for relief of arm pain. There are several ways to address cervical radiculopathy from a surgical standpoint. The more common surgeries performed to treat cervical radiculopathy include anterior cervical discectomy and fusion, and in select cases, cervical disc replacement, otherwise known as cervical disc arthroplasty. Anterior cervical discectomy and fusion, commonly referred to as an ACDF, refers to a surgical procedure in the front of the neck where the arthritis and disc material is scraped out with the assistance of a surgical microscope. The exit for the nerves, called the neuroforamen, are widened to take the pressure off the nerve to help alleviate the pain, discomfort, and sometimes weakness. After scraping out the arthritis and the disc material, a spacer, referred to as an interbody device, is placed between the two bones to help the two bones fuse together. The spacer, or interbody device, serves several purposes. First, it helps to widen the exit for the nerves, called the neuroforamen, by restoring the height of the discs back to its normal height. We refer to this as indirect decompression. It also helps to stabilize the spine by promoting fusion of the two bones, which also helps preserve and protect the decompression. An easy way to think about this is to think of a car jack that's placed in the collapsed disc space. The jack will help bring it back to height to take the pressure off the affected nerves. After this is done, a titanium plate is placed on the front of the bones with associated screws to help fuse and help stabilize the spacer or interbody in place. Similarly, sometimes, instead of fusing the spine, we remove the disc material and replace it with an artificial disc. This is referred to as a cervical disc arthroplasty or a disc replacement. This procedure helps to preserve the normal motion of the spine and helps prevent other levels of the spine from becoming worn out or degenerated and potentially causing issues over time. Disc replacement is sometimes considered in certain circumstances depending on several factors, including the amount of arthritis in the spine, the overall alignment of the spine, and the cause of the compression. There are other forms of surgery that can be used for radiculopathy, from the front of the spine or the back of the spine, depending on certain circumstances unique to each patient. If you or someone you know has been diagnosed with cervical radiculopathy, or if you're experiencing symptoms similar to cervical radiculopathy, please feel free to come see me to discuss your symptoms and find a treatment plan that works best for you. I see patients in the Plantation, Miami Lakes, and Pembroke Pines offices. To book an appointment, please feel free to visit us at www.ocsfdocs.com or to call us at 954-473-6344. Thank you for watching and have a wonderful day.